May marks the start of Mental Health Awareness Month, and today we're bringing awareness to two common mental health disorders: obsessive compulsive disorder and anxiety. Dr. Elizabeth Mackingvale, director of OCD Institute of Texas, is here to talk about the resources available in our community. Thank you so much for stopping by.
Thanks for having me.
We do appreciate it. You know, I always say a lot of the battle in a lot of these diseases or just awareness starts with a conversation.
100%.
Talking it out and knowing what it is and how we can, as a community, come together to help those impacted.
Absolutely.
With that said, what is OCD?
Yeah, so OCD is obsessive compulsive disorder. It is, basically made up of two things: obsessions, which are unwanted intrusive thoughts, and compulsions. These are repetitive behaviors that the individual does to try to reduce their anxiety or to feel better. The rituals are unwanted, and that's really important, and so are the obsessions. So these aren't things that people enjoy. It's not what people like. It's not, this kind of stigma you hear of like, oh, my coworker's so OCD, you should see their desk, right? That's not OCD.
Yeah, anxiety.
Anxiety, a little bit different. We all know what anxiety is. I don't think I have to define that, right? We feel it, especially in COVID times. We really saw it much more. A lot of us felt it in different ways. But really, anxiety is diagnosable when it's starting to interfere with your functioning.
Signs and symptoms, and these can vary depending on who you are, how old you are.
Yeah, and the type of OCD or anxiety you're dealing with, right? But overall, when we think about anxiety and OCD, we want to know, is it impacting the way you function? So the way you eat, sleep, your friendships, your performance, work, school, you name it. But signs and symptoms of OCD can be things like asking repetitive questions, engaging in ritualistic behavior, and really seeing this overwhelming sense of anxiety. And then we start to see a lot of avoidance behaviors.
When can signs and symptoms pop up? I know if we're talking about children here, is it something that they will show immediately, or adults? Can it pop up at some point in your life after childhood?
Totally, yeah. So, we can diagnose 2 to 4 years old, so we can see it really young. Oftentimes it's going to show up during adolescence, so puberty, hormonal, life changes, but we can see OCD and anxiety appear for the first time postpartum. So it can appear in adulthood, it can appear in childhood, but most commonly adolescence.
You have a personal story.
I do.
With OCD and anxiety.
Yes.
Share what you're willing to.
Yeah, I was diagnosed when I was 12. I've lived with OCD my whole life, and really there were signs and symptoms for me as early as 2 to 4 years old. Used to track the weather and have these little things that would cause a lot of anxiety for me, but they became really disruptive when I was 12. It impacted everything: the way I showered, the way I functioned, my entire family system, and treatment saved and changed my life. So that's what I get to do now.
That's really truly incredible, and I think having that experience and having that personal connection probably makes you that much better at what it is you do, helping others.
Well, thank you.
And I think that will go a long way for people watching right now, and if they have a loved one who has been diagnosed with OCD, or maybe they're not diagnosed with OCD or anxiety. How can they get involved to help them?
Yeah, totally. So the first thing is education. We want to appropriately educate. So we want people to know that OCD, anxiety is treatable. You can live an incredible life despite this diagnosis, and that there's good treatment. It's evidence-based treatment. So you want to look for a cognitive behavioral therapist, somebody who specializes in OCD and anxiety. Going to a talk therapist is not going to get you the help that you need. And unfortunately, when we go that route, which is what a lot of us do early on, we end up getting a lot worse, and then we think therapy doesn't work for us. And so we want individuals to get cognitive behavioral therapy for anxiety, OCD, any of those related disorders.
For more information on those resources, where can people go?
You can go to iocdf.org, or of course you can also go to peaceofmind.com.
Dr. Elizabeth Mackingvale, thank you so much for coming in this morning. We do appreciate it.
Thank you for having me.
Again, it just starts with a conversation and knowing more about this and helping your loved ones. That's what's key. That's key with all this. Thank you so much.